This is Shelley Kraft coming to you live on SNN Live. We're at the Dawson James Small Cap Growth Conference 2016 in Jupiter, Florida. I have with me Matthew Jones from Dyadic. It's a publicly traded company and the symbol is DYAI. Matthew, welcome to SNN Live.
Thanks for having me, Shelley.
It's good to have you. Let's start by giving the audience an overview on the company.
Sure. Well, Dyadic is a company that's been around for many years, industrially focused on producing enzymes, particularly in huge production, huge yields. A great platform based on C1, which your audience I think know well, Shelley.
Tell us a little bit more about the core of the platform, if you would.
So in biologics, particularly in the pharmaceutical sector that we'll come to, the cell that you choose and the platform that you choose in which to express your genes of interest is fundamental to how the production, how the yield, and essentially how you can commercialize that model. So choosing the basic platform, the fundamentals, is key. And within our industry, there are many options, but by far C1 is the most productive.
So what's your expertise and what do you do in the company?
So with a commercial hat on within the company, we're looking to license, we're looking to collaborate and partner with companies, particularly biopharmaceutical companies who already have an experience with cells, with expression from cells, particularly in large molecules. And obviously we're looking to bring the C1 platform from the heritage that it has with its proven productivity and its proven high yielding, that of course addresses cost of good issues and so forth. And bringing that to the biopharmaceutical industry, which still struggles to find the right platform in which to express and to remain the most competitive it can be.
So I'm going to ask you a tough question. How's business?
Well, business is great. Business is booming, actually, because if you think that really from the start of this year, from our public sale to DuPont, or the industrial piece of the business, we have now fully focused ourselves on this sector. And it's a big sector, there's lots to do. We have 4 particular focuses right now. If we think about how biologics glycosylate, we've got the non-glycosylated market, which is a huge market. We're talking about insulin, those kinds of things. And of course, we're engaging with companies where C1, which is a very productive system compared to what the industry currently uses, in CHO particularly, has a huge advantage. We're also looking at veterinary sciences as well, where cost of goods, we think, is a fundamental point to really bring to bear. And we're also looking at glycosylated markets. And then, of course, there's the new biological entity market, which is just huge. And, obviously establishing C1 as a rival platform to CHO is where we're at right now.
So in establishing this new platform, I mean, from adoption to development to distribution, so to speak, and they're using your platform, how large could that market be in particular?
Yeah, it's a really great question. I think it's hard to give you an exact number, Shelley. What I can say is if we think about insulin, the example I gave a second ago, we know that the global market is around 40 billions or so if you really bring into bear all the numbers that we see. But that number is kind of we don't care if it's 30 billion, 40 billion. I mean, it's a huge market. I think if you think about the growing population that are diabetic, if you think about the aging population and the top-heavy population that we have around the world, in healthcare markets particularly that are subsidizing or funding prescriptions, we believe that C1 fundamentally will shake up that market, given that the expression yields you currently get, we think is a multitude lower than what we can achieve, and therefore, bringing that discussion to the right pharmaceutical companies, is engaging a lot of discussion right now.
So I kind of want to hone in on the closeness to the adoption, and I think it's kind of like when you get a big company to adopt, it could seem like a domino effect. And so how close is that occurrence? And if you're receiving any pushback, what do you think is needed to overcome that?
That's a great question. So my background is in large pharma and small biotech, as well as working for CMOs, which is a good example of where Dyadic is really focused, engaging and discussing as both collaborator as well as a partner. But essentially, there's a multiple assets to this. You've got the overall arching effect that fundamentally the current platform that all of our friends in the industry are using is a platform which has a ceiling. and we can discuss, grams per liter. We can look at data out there. But if we put a finger in the market and say between 2 and 10 grams per liter is really where a lot of companies in biologic terms, play, and there are smaller and there are bigger expressions. But fundamentally, it's restricted on how good the cell can be. I think that platform is what we're calling into question. And so drawing upon the experience that the management team have, drawing upon our network, as well as the experience we've had recently where we've publicly talked about some of the large pharma relationships, I think we've got a lot to share. And I think we've got evidence now that's growing all the time, given also the public statement we had recently around a CRO of choice in Europe, a very well respected CRO that's now working on further strain development and really tweaking an already very, very productive strain.
Well, I can see how a large pharma would look at your platform if it means such a reduction in manufacturing cost. It would have to be something they would look at. But at the same time, they're moving away from a 30-year usage of CHO. So I think that's a challenge, but once that's overcome, I think, it could be very meaningful.
Absolutely. Any industry faces this. I think we look at technology generally, and particularly in the healthcare and life science sectors. I believe it's Moore's law, but there are other laws like it that describe how evolution happens in the workplace, quite frankly. And I think what we're seeing in the CMO sector, given that their bread and butter really is working with pharmaceutical companies, yes, they are very embedded and we think also have potentially overinvested in their current platforms. Now, their current platforms have a regulatory pathway and they express to the levels that the industry has sort of accepted. What we're doing, we're coming along here with evidence to say that on a multitude higher, we can express your genes of interest, and the cost of good argument, the cost of manufacturing argument is very, very tightly embedded. At a time when we see a sweet spot, we see CMOs and pharmaceutical companies now publicly committing more to single-use bioreaction. We're seeing bags, we're seeing a difference in the CapEx and OpEx view that the market has on what they want to spend and what they want to invest in their own factories and manufacturing suites. I think C1 is coming along just at the right time, and this is off the back, Shirley, by the way, of a very successful sale to DuPont, where we have had a multitude of success in the last 20 years with this platform, expressing and working with some very serious players indeed.
What is the problem or need that Dyadic at this stage is the solution for? Can you answer that?
I hope so. I think that regulators, big pharma, fundamentally the healthcare systems in the countries they operate in, biologics, we've seen the prescription levels increase. We've seen an aging population. We've seen more and more need for therapeutics in this space. But we can't afford it. We can't afford the levels of future forecasting that we're seeing. And so, fundamentally, back to the earlier point around the platform, I think if we can reduce cost of goods, if we can reduce CapEx, look at the OpEx arrangements that the companies have classically entered into and really challenge how they express and how they look for yields and production from cell lines, we also think that top down. So as governments, as healthcare systems really are struggling to afford their bills, they're going to look more creatively at companies like ours who are offering solutions to meet that need. And we are talking to biosimilar companies, biobetter companies, as well as new biological entity companies and innovator companies, and they all have the same issue. They all want to try to reduce their cost of goods. They all want to be able to have the highest safety profile, and they want to bring to market the best drugs they can. And C1 is the platform that will take them there.
Let's give out the website for more information, if you would.
Sure, it's dyadic.com, and feel free to reach any of the management team anytime.
Ladies and gentlemen, Matthew Jones, Dyadic. It's a publicly traded company, and the symbol is DYAI. I'm Shelley Kraft. This is SNN Live, and we're coming to you live from the Dawson James Small Cap Growth Conference 2016 in Jupiter, Florida. Matthew, thank you for coming.
Thank you, Shelley. Thanks for having me.
Thank you.